So we have Ahmed Sadek here for our final presentation. Thank you so much.
So we have the last speaker for the day, Dr. Ahmed Sadek from Egypt. He talks on impact of tele-dermatology on healthcare delivery systems in remote sites in Egypt.
Okay, good afternoon, everybody, and thank you for staying late and hanging up with us in here. It's been a long day, I know, and everyone is suffering from a jet lag somehow, and new weather to adapt to. Okay, so I'm talking about our experience with tele-dermatology and how it impacted the healthcare delivery system in remote sites in Egypt. No specific disclosures for the talk. Okay, this is the map of Egypt, and as you can see, we have 27 governorates. Mainly distributed at the River Nile, the valley, and the delta of the Nile, which ends in the Mediterranean Sea. And the main surface area of the country is around 1 million square kilometers. And the current population is a little bit above 110 million people living in Egypt, in addition to around estimated 60 million plus refugees. And these are the 27 governorates. You can see that the governorates that are located at the borders of the country are larger in surface area, and actually they have much less population. So less hospitals in the same context, and less number of practicing physicians. If you go here, you can see that the darker the color, the more the density of people regarding each governorate, as you see over there. And those are currently served by 35 dermatology and venereology departments of universities and university hospitals. We also have 17 Ministry of Health specialized dermatology and venereology hospitals. And I am honored by being the manager of the biggest one of them located in Cairo. It's 120 years now since being established. And we have 10,000 plus certified Egyptian dermatologists and around 3,000 trainees for Egyptian Fellowship Board or master's degree. Okay, so we have a potential for telemedicine in Egypt, a potential for offering qualitative health system improvements with the availability of quality healthcare in remote areas of the country, as I've just highlighted, with improvement in qualification of the national specialists and health technicians by creating and engaging in different medical databases. Also, we have the capability of centralization of resources regarding the presence of specialists, hardware and software packages, with reduction of waiting times for consultations, equitable access to quality healthcare services, and to reduce or at least control the cost of the healthcare system. And this is the essence of the telemedicine everywhere. The success factors for this project to succeed in Egypt is basically the definition of goals, aims, and objectives with the supporting funds from the national and private sectors, advice from experienced individuals and institutions with integration of services in the overall health infrastructure. It should start at small scale with gradual expansion with ongoing evaluation, with policies for licensing, reimbursement, compensation, liability, confidentiality, and responsibility for the patient, adherence to technology standards, and definitely regarding the human resources, awareness, training, education, management, and acceptance. Okay, it has also a financial positive impact for low-medium income countries because it cuts down journeys to major health centers with reduction of length of stays and costs of hospitalization, reduction operating costs, and costs of training of specialists. Also, it helps in raising the public awareness regarding many common subjects like skin self-examination and combating certain myths regarding the skin, like tanning is healthy or something like this. And we can do this by the presence of experienced dermatologists, having advanced diagnostic services, system training programs, and secure database and transfer system, as I will explain in a few minutes. Okay, the first trial on national basis that we have performed was actually 13 years ago, and this was sort of a mobile tele-dermatology training project, and it was done from doctors to doctors by mobile devices, and I participated in that by giving logistical support at my hospital. I was a specialist back then, and also by providing the training on dermatological photography for the doctors at remote sites using this mobile device. And since then, teledermatology has gone in every possible way. People are asking each other via private groups on social media, on WhatsApp groups, on Facebook groups, but it's still between doctors and doctors. But sometimes when the patient is following up with you at the private sector, he can ask you for more teledermatological service, but just on a small scale. The teledermatology has significantly increased afterwards because of the increased use of the social media. In addition to the period of the pandemic of the COVID, everyone got more interested in practicing this. And then, as I just mentioned, we have some private healthcare systems with individual practices. And the thing that has emerged a lot during the past year is a government-sponsored platform for telemedicine. This has been carried through physician to physician or physician to patient, but the government-sponsored platform is only physician to physician. Definitely, we have the usual limitations, like the lack of palpation of skin lesions. Some economic and technological, legal, and ethical considerations have been all taken care of because this was a common project by the Ministries of Health, Technology, and Higher Education. Each one has its own part. The technology was responsible for the central server and protection of the data and providing the logistics. The Ministry of Health by providing units that I'll show you in a moment, at the remote sites and at the healthcare provider reference sites, also with the Ministry of Higher Education. Here is a distribution of the units on the map of Egypt. And in phase one, 166 units were deployed at different sites. And in phase two, another 150 units will be deployed as well. Each unit, as you see in the image, has a digital ultrasound, a digital stethoscope, a digital ophthalmoscope, a digital ECG, a digital dermatoscope, a digital otoscope with digital thermometer and a digital sphygmomanometer and all the technical support regarding internet, electricity, and everything. So this is how it goes. The patient goes to the physician at the remote site, and if he thinks he's in need of a teledermatological consultation, the physician at the remote site, who is not necessarily a dermatologist, he can be a GP, prepares the data available regarding the complaint, the history of present illness, past and family history, and then he's enrolled to the system and takes an appointment, schedules an appointment to be consulted by the consultant present at the remote site, at the central site, which is the healthcare provider who gives the medical decision. Regarding dermatology only, during the past 12 months since the start of last July, there was more than 10,000 consultations in the system regarding the specialty of dermatology only. And at our hospital, we have seen around 25% of those, and the percentage has increased in the current 6 months. So we've seen like 900 patients during the first 6 months, and then since the start of January of 2023, we've seen almost 1,600 patients. 95 and more than 95% of those cases were managed and followed up successfully through the system by local resources present at the remote sites and shared central expertise. And a certain governorate requested, we have monitored that a certain governorate have requested more than 25% of this number of consultations. So we probed this issue and we focused on creating a specialized focused training for the dermatologists present at this governorate, which was an on-site 12 weeks training. So we analyzed the feedback and we get to improve what's present at the remote sites service as well. The less than 5% of patients were then referred to our facility where they got services at the laser, at the phototherapy, at the full body mapping unit, surgical procedures, or pathological consultations as well. And I'm going to share with you the one most interesting case that occurred during that year, the one most complicated case. He was an 85-year-old male patient who had nothing abnormal regarding his past and family history. He presented with this generalized erythema and itching of 2 weeks duration, and he was previously diagnosed 2 years ago as having chronic actinic dermatitis. He had no response to systemic glucocorticoids, hydroxychloroquine, ivermectin, and dapsone. 1 week later, he developed fever with septicemia. He was admitted, and his blood culture and sensitivity revealed methicillin-resistant Staph aureus, and his pus culture and sensitivity revealed Klebsiella. He was transferred by ambulance from this remote governorate, and he was admitted to ICU with a biopsy of the skin. Then he revealed anemia and hypoglobulinemia in follow-up. And after follow-up of the case, the pathology revealed that this was a loose reaction for leprosy. The patient was actually a leprotic patient, and this was a neglected case, and this was one of the extremes that we could help the patient more, not just by communication, but by further referring the patient to the central site. This was an overview of what we are currently doing and how we are all collaborating and how we think this is helping in elevating the level of expertise and distributing it all over the country, of delivering equal healthcare services all over the areas, and for giving an advancement to the healthcare system with less costs. And finally, I've started the way with Tele-Dermatology for 15 years now. I'd like to thank my professor, Mohammed Shaib, who I started probing into the issue and thinking about it with him, Dr. Mohammed Darwish, who is the previous manager of the hospital, Professor Ihab Kamal, who is the consultant of the Egyptian Ministry of Health, and my team at the hospital, Dr. Nihal Gadalla, Dr. Nihal Abdel Menam, Dr. May Kamal, and Dr. Ahmed Sadek for all their contribution, all their time, because we deliver at least 18 consultations per day all over the year since we have started, and this is really paying very well. I like to thank all the people who are working for that, and I hope we are going a step in a very good future. Thank you for letting us join you today, and thank you very much, and enjoy the rest of the conference.